1987 brought us the first cell phone, the boombox, the Apple personal computer, and the at-home pregnancy test. It's been 30 years since 1987, and all of these revolutionary innovations have advanced significantly, except for one, the at-home pregnancy test. It's still the same stiff plastic relic highlighted in movies for its lack of privacy. Someone finds the test in the trash and breaks the news before you can. Worse yet, they're bulky, expensive, and add over 2 million pounds of plastic to landfills every year. Meet Lia. Lia is the world's first ever FDA-cleared, flushable, and biodegradable pregnancy test. We've engineered Lia from paper, not plastic, allowing it to disperse in water and biodegrade without sacrificing accuracy. Our innovation in material science and water-dispersible diagnostic technologies means that you can now flush these tests. Let's show you how Lia works. Move to the demo, please. Lia works like traditional pregnancy tests. You simply pee on Lia's wider, easy-to-use sample pad. Today, for simplicity, we're pipetting a urine sample. You lay the test flat, and you wait for your result. We'll return to these tests in a few minutes, but this is what a negative test looks like, and this is what a positive test looks like. Please return to the presentation. There are a mix of diagnostic and consumer packaged goods companies that sell at-home pregnancy tests. Their tests are also over 99% accurate, but they do not provide privacy. They are bad for the environment, and they use high-priced materials. Plastic accounts for 52% of the cost in non-digital tests. At Lia, we're modernizing pregnancy tests, and in doing so, we're creating an entirely new category of water-dispersible and biodegradable diagnostics. Lia will be available for sale online in mid-2018. Priced similar to existing tests, Lia has the additional features of being flushable, compostable, and ultra-thin. Lia is so sleek that we can ship it to you in an envelope. The at-home global market for at-home pregnancy tests is over 900 million, and this is for pregnancy and ovulation tests. It is expected to exceed 1 billion by 2020. We have secured 3 utility patents, 3 design patents, and our ISO 13485 certification means that we can manufacture our own tests. Yesterday on this stage, I announced for the very first time our Fda clearance. This is a major milestone, and it's one that we've been able to achieve in under 2 years. We've gone from a concept to an efficacious product in that short of a time frame. We will grow our business by partnering with manufacturing experts, expanding distribution, and leveraging our technology into additional diagnostics. To show you how Lia compares to other flushable products, we've placed the Lia pregnancy test, a leading flushable wipe, and 6 squares of toilet paper in these clear tubes. To mimic flushing motions, Anna is rocking the tubes back and forth for approximately 30 seconds. Our approach to dispersibility is twofold. We've developed a proprietary coating that repels liquid long enough to take the test, but then breaks down like toilet paper when flushed. Second, we've embedded several unique perforations throughout the test's design, including a custom perimeter seal that allows the test to easily separate for faster dispersibility. After only 30 seconds, you can see the results. The Lia test breaks down like toilet paper and is much better, significantly better than the flushable wipe. And that's how Lia works. No nitrocellulose or glass fibers, no plastic housing or landfill, just sanitary, private, sustainable disposal. Can we please return to the pregnancy test from earlier? So as you can see, the test that we pipetted a positive urine sample on has now displayed 2 red lines indicating pregnant, and the one that we pipetted a non-pregnant urine sample on is showing a negative result. Please return to the presentation. Lia is the world's first ever FDA-cleared, flushable, and biodegradable pregnancy test. Visit meetlia.com to join our pre-order waitlist today. Thank you.
Questions?
Congratulations on the FDA clearance. That's awesome, particularly to get it so quickly. Tell me a bit about the marketing side of it, because one, you talked about the product differences, but you also talked about how you want to sell it direct over the web and I guess delivered through mail rather than the way that pregnancy tests are usually sold today. So why is that, and tell me a bit about that.
Yeah, so retail is still in the mix, but it's kind of a second-year strategy for us. And part of the reason for that is we want to be able to kind of use that as leverage while we're going into the distribution talks. The other thing is that we really do see an opportunity to kind of get this online and be able to take advantage of some of the unique kind of sales and marketing strategies from an online standpoint.
But you see retail as the larger part of the business eventually?
Yeah. Eventually, but I mean, I also see a large part of the business being in leveraging our IP and continuing to develop additional diagnostics, as well as continuing to build out the R&D. So, you know, part of one of the things that we've kind of really gotten into in order to make this is that we're starting to get into biomaterials. We have an understanding of being able to solve things that are either, you know, plant-based, mineral-based, or protein-based, and so there's also a piece of the business that is also R&D focused.
So those future diagnostic tests would probably be more likely, perhaps, to be ordered online, because pregnancy tests are typically targets of opportunity, right?
Yeah.
You need it right now, you're not going to pre-order it necessarily.
Right.
Or in some cases, pregnancy, obviously planned pregnancy you would. But those other diagnostic tests, you think the current learnings and IP that you have would apply to those? Oh
yeah, we've already actually proven out feasibility on additional diagnostics. Yeah.
Yeah, that was going to be my question as well. What other use cases are you envisioning for leveraging this IP?
Yeah, so ovulation obviously fits under the Lia brand very well, right, in the kind of women's health category. There's UTI, there's some additional things as well.
Can you talk a little bit about the market environment? The market seems to be at about $1 billion, and who are the big providers of these legacy devices today? And how would they react, in your mind, to an offering like this? Would they try to copy you or acquire you? What do you think is the likely outcome?
So there's 3 main players in the United States in terms of brands, but there's also a large generic market as well. So a lot of them are having their tests manufactured in China and then just kind of branding them or white labeling them. I think one of the unique things for us is that this is a true innovation in the category, and one of the first that's happened in over 30 years.
And in terms of price, how would you compare to existing solutions, and would that be a competitive edge for you or rather a challenge?
Probably at some point a competitive edge. We see this as being parity pricing, at least initially. Some of the price sensitivity studies that we've shown, if it's priced too low, it actually seems not being as accurate. And for us, in the initial phases, we have a little bit of labor to deal with.
I have a more fundamental question on why you chose to address this topic, because it seems to me that the problem you're trying to solve is not actually related to a woman's experience in figuring out whether she's pregnant or not. The experience is very similar, right? The problem you're addressing is more around the environment. So why apply that to pregnancy testing?
Actually, privacy is also a really big factor.
In what way?
Women who do not want to be pregnant, or women who are testing frequently and trying and having trouble. The fact that they're having to
flushing it,
yeah,
okay,
versus hiding a test in the trash. There's a lot of stuff around that. So there's stigma on a couple sides. We've also heard a lot of stories from women who are struggling to get pregnant, and kind of how upsetting it is to see several ovulation tests and pregnancy tests pile up in the trash. Women testing at work. There's a lot of kind of more private-based reasons and rationale to allow this.
So if I might just give you my 2 cents, I would actually emphasize that point a lot in your marketing, because when a woman is trying to figure out whether she's pregnant or not, she's either really hopeful and excited or probably freaking out. There's no real in between, right? So maybe the environment is not the first thing that she's going to think about in terms of, maybe I'm wrong, but in terms of choosing something off the shelf, whereas privacy maybe actually I think is a much better angle.
Yeah, I mean, we kind of position it differently to each of the audiences. So it's a little bit of a separate targeting play.
Why would somebody pay the same for your test as for a digital test?
Oh, not the same as a digital. No, digitals are much more expensive.
Okay, so this is the same as like a regular indicator test?
Yes.
Okay.
Yeah.
Can you tell us a bit about your backgrounds and how you got to this?
Yeah, so Anna and I met at graduate school, and this was based on my research at the University of Pennsylvania.
Okay. And so what area was that research?
Engineering and particularly integrated product design, and then spent some time obviously in the bio lab, a lot of material science as well.
Okay.
How much money did it take you to get to where you are today, and how will you raise in the future, if at all?
Yeah, so we've been really capital efficient to date, and we are looking to do a Series A at this point. We still have, a nice runway, but we're going to have to do a Series A to get into the market for commercialization.
And is the vision to build a broader product set and build a brand around degradable healthcare items or personal care items, or is this just around women's healthcare and pregnancy?
No, definitely the first.
Okay.
So, the way that we're looking at this is Lia Diagnostics is the company. Lia is the brand that we've created to, really leverage the innovative diagnostic, and we can build that out for additional women's health applications. So there's additional self-testing that we're looking at that is women's health-based that would also be discreet and sustainable. So that's kind of that sector of the business, and then we would continue R&D for additional sets. Potentially building out small brands and or licensing strategies at that point for some of the other diagnostics.
So my question is about market testing. How did you measure the demand, and where do you project that in the next year or two?
Yeah, so we have done several third-party market research tests, and then additionally when we did our usability study, we talked to all of our beta testers. So 92% of the beta testers would purchase the test again in the future. And we've also seen that 79% of women would purchase this over competitive tests, privacy and sustainability being the largest reasons. Also, the fact that it's ultra thin was one of the other really big stated reasons. And so those are kind of the bigger numbers around the interest.
And on the accuracy front, what was the FDA criteria?
Yeah, so I'm going to let Anna answer that one. She's kind of been holding up she's regulatory heading it.
So our FDA clearance is based off of a 510K saying that we're substantially equivalent to pre-cleared devices. And so the standard there is over 99% accurate. To date in our testing, we've had 100% sensitivity, 100% specificity. So that's no false positives, no false negatives in lab and in our user studies.
FDA just does not allow you to state that, right? Because it's possible that you could eventually get one. But
congrats on getting that, by the way.
Thank you.
Yeah.
Thank you.